you've had breast cancer before, you are likely to get another breast cancer. Say you've had breast cancer of your left, there's another chance of getting breast cancer on the right. So the number one risk is having a breast. That's your risk. So all of us are at risk. Even the men are at risk. Just that 1% of breast cancer cases are found in men.
You'll be told, allow the men to suck your breast. Allow the men to touch your breast. I don't know the magic they do on the breast. Is it true that when men suck your breast, you don't get breast cancer?
So you think they can suck the breast cancer?
No, what she's saying,
allow the men to hold your breast, touch your breast, suck your breast, and then it reduces your risk of getting breast cancer.
This is not Crystal's chit chat. Accra, Ghana, trying to create a buzz to let everyone know, the difference of opportunities you have out here, the different places you can go, what's the difference. We're here just to educate you. Today I have a breast cancer surgeon. You want to introduce yourself?
Okay. My name is Dr. Victoria Senagao, and I'm a general surgeon, a senior specialist with the Greater Accra Regional Hospital.
Thank you. Thank you for joining us. We really appreciate you taking your time out and coming to join Marsaw Media with this pink conversation. Would you like to introduce yourself?
My name is Vivian, and I'm with Marsaw Media.
Okay. Thank you. Thank you for sitting in this today with us, because you always shy away from having this conversation with us. All right, so I have some questions I want to ask our lovely lady right here that works on a lot of breasts and does a lot of surgeries, and just to get educated on. This is just the surgery part of it, but we gonna touch bases. This is gonna be a conversation. We want to try to get as much as we can out as little time we have. Okay, so my first question I have for you. Are all lumps in the breast cancerous?
No. Most lumps you find in the breast are not cancerous, but some are cancerous. So then the ones that are not cancerous, we call them benign breast lesions. And the ones that are cancerous, of course, they are malignant breast lesions. So these are the two types. And we have a lot of benign breast lesions. That's why we don't want the woman to be scared when you find a lump in your breast. Just present yourself to a doctor, and the investigations will be done to differentiate whether you have cancer or not.
Okay, all right. What are some of the risk factors for developing breast cancer?
Okay, so first I would want to just explain what the breast cancer is, if I may.
Yes, please.
Okay, so then first we have to understand what cancer is.
Okay.
So cancer is just abnormal growth of cells, so of any organ. So that's why you can have liver cancer, you can have prostate cancer, you can have cancer of your nail bed, you can have cancer of the skin, you can have cancer of your eye, of your ear, your nose. So once the group of cells are growing abnormally, the way the God in his wisdom made it, as some cells are growing, they are dying also. But if, for instance, that part, your organ, the cells are growing abnormally, they are not dying to replace, there's always a balance. That balance is lost, then you develop cancer. So breast cancer is just abnormal growth of cells in the breast.
Okay. So do it have something to do like the white cells and the red cells?
No.
They don't?
No.
That's how much I know.
No, they don't have to do with that. So let's just take it as that for now.
Okay.
But you asked about the risk factors.
Yes.
So the number one risk is having a breast. That's your risk. So all of us are at risk. Even the men are at risk. Just that 1% of breast cancer cases are found in men, 99% in women. So all the three of us sitting here, no one is protected. We are all at risk. So that's the number one risk factor. The number two is increasing age. So over 40, 49, that's when sometimes we see the peak, but from 50 going upwards, that's the second biggest risk factor. And that's a risk factor for all forms of cancers, because you do have a lot more cancers in older people than younger people. But that's not to say that we do not record breast cancer in younger people. People in their 20s and 30s, young women are presenting with breast cancer. But increasing age is a risk factor for breast cancer. And another major risk factor is hereditary. So if you have your immediate family, your mother, aunties, haven't had breast cancer, you are at 50% risk. So for instance, if your mother has or had breast cancer, you are at 50% risk than me. Or if my mother had breast cancer, or your aunties, your immediate family members have breast cancer. So those are the major risk factors: having a breast, increasing age, and hereditary. Then we have other factors. Now, as women, we produce estrogen, and that's what feeds the breast cancer. Okay. So that's why women are more at risk. Or women, 99% found in women, although men also have breast, because of the estrogen we have, which gives us our secondary sexual characteristics as women. That's what makes our breasts, we look like women, curvy and all that. So when you have been exposed to estrogen for a longer period, you are at risk. Now, who is more exposed to estrogen? Someone who has never been pregnant before. So that's a nulliparous woman. That's how we call it. You are at risk, more risk than somebody who has ever been pregnant. I'm not saying to have had a child. I'm saying pregnancy. So if even you've not had a child, but you've been pregnant before, you have some protective elements. Why? Because during pregnancy, another sort of hormone takes over your body than estrogen. So there's a break in your exposure to estrogen. I hope you understand what we are following me. So during pregnancy, there's a break in that exposure. So you have some protection. Then after pregnancy, or whatever happens to the pregnancy, you are re-exposed again. Yes.
Why do you think? Because the milk that goes, that's in your breast, that you're protected?
No. What I'm saying is that there's a break in the estrogen during pregnancy. Your exposure to estrogen. You don't produce as much estrogen when you're pregnant. Another type of hormone takes over. There are other hormones that will take over. Okay. So that's why. So somebody who has had multiple pregnancies is always having a break. So it's a bit protective. But you will ask, you have women who have got 5, 6 children also having breast cancer.
Yeah.
That's also there.
Yeah.
So nulliparity is a risk factor. Early start of menstruation, which we call menarche, is a risk factor. So someone who started menstruating at the age of 10 starts getting exposed to estrogen at an earlier age than someone who starts menstruating at the age of 14 or 15. Then again, on estrogen exposure, late menopause. So if you attain menopause maybe at 55, 60, and you start menstruating around 10 years, look at all these years you've been exposed to estrogen. So you are at a risk factor. Unlike another person who may have started menstruating at 15 and reached menopause at 45.
Okay.
So those are. Then oral contraceptive use. So not just, but the significant risk factor comes when you've used oral contraceptives for at least 5 years. So if you are planning your family, and this we really want to talk about it, so you don't carry the wrong information across.
Yeah.
Okay.
If you are spacing your children, you've taken oral contraceptives for 2 years, you have, that does not put you at risk. What I'm saying is use of 5 years continuously without break puts you at risk. Again, is a exposure to estrogen. Right. Then other risk factors, probably you've had some hormonal treatments before in the past, it puts you at risk. Again, it's the exposure to estrogen.
Okay.
Or you've had breast cancer before, you are likely to get another breast cancer. So you've had breast cancer of your left, there's another chance of getting breast cancer on the right. So those are some of the risk factors for breast cancer.
And that's one of my biggest question I have. Why does it always develop in your left breast?
No, it does not.
It seems like everyone I speak to, it always have it in their left breast. I rarely hear anyone say they have it in the right.
Okay, so I have seen more than 3,000 patients.
Yeah, I know. That's why I'm asking you.
And there is no.
That must be
There's
scary.
no specific.
Yes.
Okay.
No.
All right. Because I was just wondering. I was like, why? Because it makes you kind of does
no,
like
it's just
think
coincidental.
like why is always left.
Yeah.
Okay.
Dr. Sena, 1 minute. Dr. Sena, with the explanation you just give, does it mean that lifestyle has nothing to do with breast cancer?
So there's it's good you've raised this. That's bottom on the list, like fatty diet. Smoking is a risk factor for almost all types of cancers because it changes your cells. It's toxic to your cells. It changes your cells. So lung is number one, of course. Every cancer that you find, there's an underlying risk. Smoking as an underlying risk factor. So that's why we are not really big on it. Not to underplay it, but lifestyle changes. Yes, fatty diets. They talk about smoking, alcohol, but those are very low on our list. Yeah. Okay. We don't want people to be big or concentrate on those ones. But if, for instance, you're talking about lung cancer, smoking is number one on the risk factor hierarchy. You understand?
But you just mentioned that taking in contraceptives can put you at risk of getting breast cancer.
You see, I didn't say that.
Okay, like within a continuous for 5 years.
Oral contraceptive.
Oral contraceptive,
Yeah,
continuous
so
for 5 years.
If, for instance, your method of contraception is the intrauterine device, like the copper device, for instance, you are not at risk.
Oh.
Do you understand? If you go for an injectable for 3 months, that doesn't put you at risk. Are you linking the oral contraceptive use to lifestyle?
No.
Okay.
I'm not linking it to lifestyle.
Okay.
I'm only thinking, when you mentioned it, I was only thinking this is the first time I've heard someone say oral contraceptive can contribute to breast cancer.
For 5 years.
For 5
Add
years.
that part.
For 5 years, yes. Oral
More than
contraceptive for 5
years,
years.
yes. So if you do it 2-3 years, you are spacing your kids, it's fairly safe.
That's dangerous.
No, it's not.
Let's continue. That's dangerous, but I mean,
But you said it's dangerous.
it is.
How can we better educate people with breast cancers with the early signs of detecting if you have it, or what can they do to just self-care?
Okay. So there are some signs and symptoms of breast cancer that the woman should be able to pick up. So you may notice, so that's why we advocate for the monthly breast examination, that there's a lump in your breast. Now, for breast cancer especially, it's painless most of the time. The lump is painless. So for women who usually present late, their reason was, oh, the lump was not causing any problems.
Oh.
If you have a painful lump, then you should be rejoicing, because it's not likely, probably, but breast cancer lumps, most of them are painless. Needless to say, they could be painful also. So the presentation, the first thing will be a lump in your breast. Even more so, there are some breast cancers. So we have different types of breast cancers. There are some breast cancers that there's no lump in the breast. That's why we talk about screening, doing your mammogram or ultrasound. You will not feel anything in your breast. Okay. So for that, let's say the change would be, you know your breast, you know your body. There's an asymmetry. Usually one of our breasts is bigger than the other.
Sure.
But this time around, you may feel like, this one is bigger, way bigger than the other. There's an asymmetry. So that's also a sign that you should have your breast checked. Then there may be a lump in your breast. It could be painless or painful. There could be some skin changes around the breast, so it'll be ulcerated, or you see some dimpling, like pimples, or what we call peau d'orange, the peel of the orange, the outer covering. You see the, we call it peau d'orange. But by the time you are saying that, then it's locally advanced. It's spread to your skin. That's what we call it, locally advanced. So skin changes, the skin may be darkened in that area, or there could be an ulcer, there be a lump, then nipple discharge. So during the breast examination also, you need to press and see if you can express something out of your nipples. So there could be bloody nipple discharge or any other nipple discharge. Then again, there could be a mass in your armpits, your axilla. So those are some of the signs.
What about sharp pains like that will go through your breast sometimes?
I wouldn't say that. It's no.
Like sometimes you could just get like a sharp pain. Like
remember your breast actually sits on your pectoralis major muscle. There's a muscle that the breast sits on. So you could be having muscle pain also.
Okay.
Yes. So the breast is sitting on a muscle. So it could radiate and you would feel all that.
On the subject of nipple discharge, let's say you have a child and you stop breastfeeding for a while. You realize you have some nipple discharges. Is it let's say I knew someone who had a child, and after she stopped breastfeeding, there was nipple discharge and no one cared about it because it's just normal. Then after some time they realized she has breast cancer.
Really?
Yes.
So the nipple discharge, so we have so if you are breastfeeding, or you could have what we call a galactocele. That's a mass in your breast.
Okay.
And it may present, you may think it's breast cancer, but it's benign. Then we have what we call duct ectasia. You still have nipple discharge. Again, not all nipple discharges is cancer.
Okay.
So there could be other things. So if you have the nipple discharge, get it checked.
Okay. We just had a young lady just join us. Her name is Deja.
Hello.
Hi. She came to have this conversation with Get Educated. She lives here in Ghana now. I'm from the States. And we're just trying to help everyone that's don't know where to go or get educated, or what's the resources that we have here, or the procedures, or whatever we can do to help each other, support each other with this month.
Because I've actually had a few deaths in my family because of breast cancer, so I would love to get some more information on where I would go to get mammograms and exams and
screening.
So I'm in my 30s now, so I hear that this is the time that I would have to go and get the checks, right?
Well, they say 40. But I think it's not. I know they keep telling me 40, but I keep saying younger women need to get checked too. And that's what she was explaining to me. Like, it doesn't matter that, it's just as you get older, the risk becomes higher. But it's always good to check and just stay on top of it. And especially if you have
a history in your family.
A history, yes.
Yeah, on both sides. My grandmother from my father's side passed away from breast cancer, and then on my mom's side, my grandmother's two sisters passed away.
So you have a significant family history.
Right.
Very significant. So you need to be checking yearly and always examine your breasts monthly, and then every year since you are in your 30s. So you mentioned a mammogram. You would require an ultrasound.
What's the difference between a mammogram and an ultrasound and a breast screening? Those three, what's the difference?
Okay, so if we talk about screening, you can screen for any disease. Okay, you can screen for prostate cancer, you can screen for gastric cancer. There are different modalities you screen. Screening means detecting the disease before it manifests.
Oh,
That's what screening means.
okay.
So before you know you have breast cancer, we know you have breast cancer. Before you start having symptoms of breast cancer, it's been found you have breast cancer. That is screening. So what are the modalities? So the modalities is imaging. What you cannot feel, the x-ray, the ultrasound, the mammogram can feel. So the ultrasound, I'm not a radiologist, but ultrasound, they use an ultrasound
Ultrasound machine.
to scan your breast, and it makes use of sound waves. That's what I know. Mammogram also a different modality, but the most important thing is that ultrasound is better, it's more sensitive for the dense breast.
Okay.
Oh,
So when you are below 40, we assume your breast is dense, it's thick, it's all that. So
it's not falling.
it's not falling.
Yes.
Thank you. I didn't want to say it's not falling, but you have said it. Yes, it has
It's
tissue.
firm.
So the sound waves are able to penetrate. So it's more sensitive. So if you go and do a mammogram, so if even a doctor writes an ultrasound for you and you go to the diagnostic center, a mammogram for you, they'll do an ultrasound for you.
Okay.
Because the mammogram will not be as sensitive. But the mammogram is more sensitive to less dense breasts. So the over 40s get mammograms. Then the under 40s get ultrasound. But you have a lot of lay people always comparing notes in church and all that. Oh, after church. But they made me do an ultrasound. The doctor is not good. Should have made you do a mammogram. Then you spend the time insulting the doctor after church. The doctor
We
is
don't really insult you. We just say nice
Why
words.
you giving me an ultrasound?
Yes, the doctor is not good. Don't go back there anymore.
But which one is
My
painful?
first,
None is painful.
my first mammogram, my first time I got my breast checked, it was a mammogram. I never got the ultrasound in the beginning.
How old were you then?
I was in like 45.
Yes, that's why you got a mammogram.
Oh, okay.
Because you're over 40.
Okay, because I was like, when I first, it was like 40, like, I was 45, and they went on and just
Yes.
gave me the straight mammogram, so it
So
was like a painful.
even the mammogram for over 40s, we can still do mammogram and a complementary ultrasound. So probably the radiologist is looking for something and couldn't really find it, thinks he needs an ultrasound, they'll do that for you. But all that I'm trying to say is that mammogram is mainly for the older people. So a 20-year-old would not get a mammogram, will get an ultrasound.
Okay, yeah.
Okay,
All right.
that's nice.
Is there any way to take caution on getting cancer, breast cancer, or like prevent it, like eating habits or something? I do see that soursop is a good benefit. Is that diabetes or cancer?
That's for all kinds of other stuff. I don't think mammogram. I mean, breast is something different. I think it's from your hormones, right?
Yes. I don't, the only way you can
Gaining
prevent
weight.
it, the surest way, like I have explained so far, that it's mainly from estrogen production.
Yeah.
So the only way you can prevent it is to prevent yourself from producing estrogen. Okay, how would you do it? You cut off your breast, all your breast, then you don't get breast cancer.
Right. Okay.
But then, where is the estrogen coming from? It's coming from your ovaries. So you take out all your ovaries.
Whoa.
Then you are sure that you never get breast cancer. Like Angelina Jolie, you realize that she has a very strong family history of breast
Yes.
cancer. You know Angelina Jolie, right? So she has a so that's a prophylactic. She does a bilateral mastectomy, and then she takes out both her ovaries. She does an oophorectomy. So she knows that
I
she
was
has.
wondering why she did that.
Yes, so that's the only way. So if you want
and she was
to
in
know,
her 40s when
yes,
she
so
did
if you
that.
want to know how you cannot get breast cancer ever, that's the radical way of going. But
Yeah, that's like
That's
really that's scary.
That's-
Like
that's a lot.
I don't think I can live my life like that.
yeah.
Right.
So that's why the screening comes in. Just we detect it early and then it's treated.
But you realize in most advocacies, you'll be told, allow the men to suck your breast, allow the men to touch your breast. Is it true that when men suck your breast, you don't get breast cancer?
No, it's not true. There's no science behind that.
So there's no proof.
Yes. Yeah.
Thank you for that clarification.
So you think they can suck the breast cancer?
No, they just say allow
No,
the
it's
men
a myth. What she's saying,
allow
it's
the
true.
men to hold your breast, touch your breast, suck your breast, and then it reduces your risk of getting breast cancer. I don't know the magic they do there.
That's interesting.
I don't know the magic they do on the breast.
This is not Crystal's chit chat. But sometimes, like when men grab your breast and they squeeze it too hard, like that,
Like they're squeezing a
it
sponge.
hurts. Like that, it's like whatever that ball in there is.
The areola.
That thing in there. What's that thing called in the side of there?
Is it the muscle?
No. It's not muscle anymore.
You know we not educated on breast.
So if
Don't your chest have muscle? No?
The breast is sitting on a muscle.
so all
But
this
it's
is
something
what
like that thing in there, like that ball in there. You know,
Ball. It's
it's
all
something
fat.
in there.
it's fat.
Oh, it hurt.
Oh,
You feel it? You see what I'm saying?
Now I know what you're talking about.
Yeah, you feel it, like you go around and you can feel it, like
like there's something in there.
yeah.
No, so the breast
You
is
never felt your breast
just
before?
fat, which
I
is
have.
septated. So it's just fat that's septated. So you feel like your breast is doughy or it's
Yeah.
it's just fat.
This is fat.
It is.
Yeah.
Thank
It
you
hurts
for
sometimes.
clarifying the myth about the men using their breast as a practicals.
Well, that's the exam right there then. No?
Yeah.
When they do.
Like when you
you-
squeeze it, make sure tell me if you feel any lumps. They probably can feel it better than you can, because you really, when you feeling that, you think you feeling something, but are you really feeling it? Because it is fat, you know. And some breasts are sensitive. Like I know my breasts are sensitive, so if I squeeze mine or push mine so hard, I'm real sensitive, knowing that I don't have, lumps or anything, but they're still like sensitive. Why do you think that is?
I don't know. But what I do know is that since you may not know, is this a lump, is this not a lump, then you need to
That's
be
the reason
examined.
Yeah.
Yes.
That's how I end up going to get examined, because I was doing something in my breast. I was like, why did that hurt like that? And I was like, you know what? I'm going to get checked, because I didn't know if it was a lump or not a lump. But it was always benign, because it is fat. It's benign. That's a form of fat, right?
No.
I know, because it seemed like, when you start gaining weight, you get all this fat in there, your breasts go get bigger. And so the benigns that you have in there, I was thinking like, okay, it comes from fat. It's like a part of fat.
No. I'm confused. So the what I'm saying is that if your breast gets bigger, it may feel doughy. Means like a dough.
Mm-hmm.
Okay.
So, it doesn't mean that there is a lump in it, but if you are not sure, you have your breast checked.
You have to get
And what I'm saying is, if there is even a lump, probably it's not cancer. It could be non-cancer, which we call benign.
Okay.
Yeah.
Okay. What are some of the misconceptions that we have about breast cancer, and how do we address those?
Okay. So I'll speak for Ghana. Like some of the myths that the patients presented. Like I mentioned, most of our patients present late. Although they feel the mass, they do not present to the hospital early, because the number one myth is, once you come to the hospital with a breast lump, we are going to chop off your breast. And no woman wants to lose her breast. So they would rather go to the prayer camps and do herbal medicine and all that. I mean, it's good to pray, but we should also, alongside the medical care, is the best. So that's the number one myth. We don't fancy cutting women's breasts every day, and most of the breast surgeons in Ghana are women actually. So it's not something that we fancy to do. So it depends on the stage you present at. So if you present early, we can actually conserve the breast for you. We just take the lump and a bit of tissue, normal tissue around it. And then we have what we call axillary clearance. We clear the axilla of any nodes. You continue with other treatments, chemo, radiation, and then you are good to go. However, if you present in late stages, stage 4, stage 3, stage 4, and it's already locally advanced, there's nothing we can do than to take out the breast. So that is it. And another thing is, it's not, and if the cancer is way advanced, that it has what we call metastasized, spread to other organs, the first place it goes to is the lungs, because it's really close by. So the cancer has spread to the lungs, it's spread to your spine, it's spread to your liver. We cannot do surgery for you. So rather, when you come to the hospital and we offer you surgery for your breast cancer, rejoice, because we are aiming at a cure. Once we tell you we cannot operate on you, then we cannot cure you, because it's already spread to your lungs. We cannot go and take out the lungs. It's already spread to your spine. We cannot go and take out your spine. So the late stages of breast cancer, no surgery. So the ones we can cure. So when we do surgery for you, we are actually aiming at a cure. Yeah.
That happened to my aunt. She went for breast cancer, and then when she went, it spread it to like her lungs, her back.
And did they do surgery for her?
No, it wouldn't. It's like one doctor that would touch her, and he was in another state or something, and it was hard to get with him, but it was only one person that would do the surgery, and it was very hard, like, because she was thinking like, okay, I took all my breasts off, so now how did it spread through? And then that's the part I was telling you. The experience I have here in Ghana is you guys, I mean, not to discredit my American doctors, I'm not doing that, but when it comes to knowing different reasons and what can happen and what can't happen. Like you said, if you come and you're already in stage 5, you can't do surgery because you don't know where that cancer then spread to. And instead of just chopping her breast off, knowing that her cancer had already spread it to her body.
Okay, not to defend them, but let's say the cancer, it's already spread though. It's spread to your lungs, but it's just one nodule, like one part.
Okay.
For centers, like high-tech centers who can do that, they could actually take the breasts and then go for that one nodule. But in case it's all over, which is what we see most of the time, everywhere, or it's spread all over your liver, we can't take out the liver. But if it's just a section, a small nodule in the liver, you could take out the breast and then go for that. That's a bigger surgery. It's a whole lot. Patients may not even be as stable to even be able to do that kind of surgery on them.
Yeah, they wasn't able to, once they actually did detect it until after the fact, and it was like, there was no one there that can do that. And so when they sewed her back up and did everything, it was like, okay, you have to come back to the doctor and we have to look at your lungs. And she was like, well, it made you feel like, why did I cut my breast off? I should have just lived the rest of my life.
Okay, so I forgot to mention, the only time also here in Ghana that will do surgery for a metastatic breast cancer, okay, that means the cancer has spread, is what we call toilet mastectomy.
Whoa.
Okay, meaning that the whole breast is ulcerated, it's smelly. Your caregivers cannot even take care of you. No one can come near you because the breast is all sore and smelly. So sometimes that's just to improve your quality of life, but it's not to cure you. So rarely we do that. Well, toilet mastectomy. So we are just cleaning you up. But even most of the time, those would have ulcerated and be chopped off automatically by itself. But you cannot even come close to that patient.
Really?
Smelly, yeah, the smell alone. So the patient may not be able to get care givers and all that. So we could do that just to improve quality of life for some few months. So that's the only time we may do surgery for breast cancer that has already spread. But if it's already spread, you go on chemo.
So that smells like a bacteria type smell.
It smells like
It's called toilet?
yeah, a toilet mastectomy.
Yeah, that's like the worst thing you can smell, right?
Yeah.
Wow, I've never heard of that.
Me either.
Never, I never heard of that. I never even think that your breast could smell like that.
It can. It does. When it becomes ulcerated.
Oh yeah.
And we so that's the late stages, and a lot of people present in that stage because they don't report early.
Okay.
1 minute, Dr. Turner. On the subject of misconceptions, does deodorant cause breast cancer?
No, it doesn't.
It doesn't.
No.
That's a good question.
Oh, okay.
So, do you guys have a lot of diasporas that come into your center and have breast cancer?
Do we have a lot of
Diasporas.
oh
Diasporas.
like those from
Americans from
and
different
the rest?
countries.
No, I've been in Kolebu for a while now in Rich Hospital. Not really, but I'm sure those in the private hospitals may see more people. Yeah.
And why you think that? Because
Because we are a government institution and we are cheap.
I mean, it's hard to get insurance. I mean, you can't use your state insurance over here, can you?
No, you can't, but you can get our insurance here.
I think you can get international
Insurance.
And there are various forms of insurance. Even in even the private insurance, most facilities take it.
Okay.
Yes. Yeah.
Yeah. So also I was wondering, like, what's the percentage of Americans that, because I know as being an American, we come over here for healing, for holistic, for good eating, health reasons, and we try our best to, stay on top of the things we didn't do in the States, where we already ruined a lot of things within us. So when it comes to breast cancer, it's like, what are some of the resources as being a diaspora that can help us? Like, I know, so a lot of people, they know where they can go, but how can diasporas find resources for us to help, instead of like just walking to the hospital like, okay, I want to get a mammogram, you want to kind of be like how we're talking about it, like how can we, is a resource center we can go to or call or?
call center or
Oh, so yes, so the Breast Society of Ghana, there's a call center you can call if you need help, if you don't know what to do, if you don't know where to go. But then, for instance, the Kolebu Teaching Hospital, we have a whole unit. We run a breast clinic, and then the days that you'd come in, if you just have a
You
breast,
just make a call and make an appointment.
you don't even need, okay, you could call and make an appointment, or you could walk in and then we book you. Yeah. Or if we can see you that day. So usually Fridays, new cases, there's a whole clinic just for breasts.
Okay.
So you could walk in. But then I think any other hospital in Ghana here, you could walk in and then a doctor can see you. So for you from the diaspora, or you could, as you come in, you could have a dedicated doctor. You could find a family physician who would be taking care of your health needs. So if you need something, your family physician knows it's about time you get your mammogram done. It's about time you get this done.
Or they keep up with your chart.
Yes.
And that's where I'm trying to get to, develop my chart so you can get to know me, and like I have high blood pressure,
Yes.
and so and just have that one family doctor, that
Yes.
one person that makes sure hey, so it's time,
Yes.
because we get so caught up in work and life.
And I think it should be easy to get.
Okay.
It should be easy to
Because in the
get.
States, baby, you get an appointment to get a mammogram, it takes about 6 months.
No, you can do it in the next hour.
What?
Yes, you can go to any of the. You can go to Quest. You can go to Sonotech. You can go to.
Sure.
Oh yes.
Really?
You just need the
Yes.
request and go and sit there, and then you have it done. That's all.
I didn't know.
No,
It's
that
a,
takes long.
yeah,
Pardon?
I didn't know that you could just walk in and just do
Yeah.
that. I thought you had to make an appointment.
No. But then you need a request from a doctor.
Oh, that part.
Yes.
That
So
part.
you get your request, and then you can get it done the same day or the next day.
Okay.
That's what I
So
mean.
you had to get it from the doctor. Okay.
Yes.
So your doctor have to tell you that. You
Yes,
know,
because-
so it's like referrals.
Yeah.
Okay.
No requests.
So, you go to the doctor,
and the
tell them
doctor.
you want to get a mammogram.
No, so you tell your doctor the problem, and then the doctor knows what to get for you. Like how you wanted to get a mammogram.
Yeah.
So that's how you would have walked to the diagnostic center that you want a mammogram. Meanwhile, you need an ultrasound.
Right.
So you go to the doctor, and the doctor determines what you need, and that's it for you. Of course, you can contribute that. Oh, can I? Or maybe I still want to maybe have my bloods run. I want to know my blood level. It's all
Just a
suggestions.
yearly checkup.
Yes.
Yeah. That's why I usually get my mammogram once a year. Do you think it's good to get it once a year or twice a year?
Okay.
For when you're older.
Okay, so this is our protocol, and this is what we advocate for. For over 40, every year
Okay.
you get your mammogram done. Every year around the same time. So if you choose October, you can have it done every October. If it's November, you get it done. Every November, you get it done. For under 40s, you can do it every 3 years. You can do your ultrasound every 3 years. Doesn't have to be every year, but for over 40s, every year. For everybody under 40, over 40, monthly breast examination. So you choose, for the monthly breast examination, you choose a period of the month, say at least 3 days after your period. Don't do it at a time when you know you are ovulating. Then your breast is tender, it's a bit painful. You may not, it's engorged.
You're gonna feel something.
You may
in there.
not, you may or may not be able to feel something. So when everything is over, there's ovulation, menstruation, everything is passed, then maybe on the 5th day or so, you could do your breast examination. And the way to do it is you're using the pulp of your fingers, then you press against your breast, against the chest wall. The breast has 4 quadrants, and then there's the middle, the nipple area. So make sure you go through all the quadrants and then the nipple, and then you feel your armpits also for any lump. You have to dig deep into your armpits. Yes, to see if there's any lump there. Finally, you express your nipple to see if there's any nipple discharge.
And so you touch bases about the under 40 and 40. What about over 50?
It's over 40.
Oh, so over 40 is once a year.
It covers
So
40, 50, 60.
50. Okay, so even if it's hereditary in your family, it's still just once a year. Okay.
I need you to clarify one more misconception. With women, we put on bras a lot. Does a metal in the bra affect, or the way you hold your bra, you make it so tight for your breast to stand firm?
No, it doesn't.
Does it affect?
Yeah, so that's also one of the myths that maybe wearing of tight bras can cause breast cancer. It doesn't. It just causes you discomfort maybe, but it doesn't progress to any disease. It doesn't cause any disease.
Oh, so the wire doesn't?
It doesn't do anything.
I always thought that copper gave you breast cancer.
No,
Really?
it doesn't.
Because it's like lead. Yeah, it's a lot of because that's what they tell us. The lead that's in the wire, that you know how you sweating.
So I think from today, what we should let's think of estrogen. Let's think of
Yeah,
let's think,
estrogen.
let's think of science.
Yes, the
Yes.
number. That's the key
Yes.
of it.
Yes. And the fact that
Estrogen.
we are women.
Yeah.
The fact that you're a woman.
That had nothing to do with the bra, how
No.
tight it is, or anything.
No.
Nobody sucking on it.
No.
Like,
The fact that you are a woman You are at risk.
The estrogen
That's
in
all.
your body.
Yes.
All right.
Oh.
So,
That's interesting.
yeah. Oh, it's so hard being a woman. It's so hard being a woman, especially when you get older. And then, like, over 50, you was like, everything just start, like, you just start attacking everything.
I'm feeling at 30. My knees hurt.
Oh, Lord have mercy. Girl, you got to get out there and start walking. All right. Is there any other questions that you guys would like to ask her?
No.
And we answer everything?
Where can we locate you? If I want you,
Oh,
if I want you to
please
do that for
tell
me.
the audience where we can locate you, because you know me personally, I explained to you how scared and frightened, and I have trust issues with doctors and everything, and so you will be like one of the people that if I had to do any type of surgery, I would want to be able to get in contact with you, because how you educated me on this and how you let me know, and you just make me feel warm that I can trust you. Like, I'm just gonna put all my breasts into your hands. Please try to save them.
So
please tell the audience, how can we find you?
I'm at the Greater Accra Regional Hospital, formerly Ridge Hospital.
Okay.
Yes, so that's where I am. However, if you cannot come there, you want breast care, the breast surgeons in Kolebu Teaching Hospital, 37.
No, I want to go to
Everywhere.
everybody. I want to go to everybody. I want to go to you.
Yeah.
I'll be like, hey, I got your number, I'm calling you. Like, okay, so I know I need to see this person and that person before I get to you, but we got to make sure I'm in that circle that you in that room when it comes to it, you know, because it'd be like, this lady right here is look. All
We're
right.
bringing our breasts to you, put it on the plate, and then we'll serve our breasts to you.
Be like, these are your breasts right here. Do you still want them? Nah, but you have to laugh to keep from being serious and taking it so. When it comes to breast cancer, everyone gets scared.
Yeah.
When it comes to any cancer, I don't care, breast or any kind of cancer, you hear cancer is like, it's a mental thing.
Yes.
And it takes over your mind.
Yes.
Because 2 years I got, and I had my mammogram done, and they saw 2 lumps. And then when I would go get my biopsy, they disappeared. And so they steady like trying to go in, and it's like 3 doctors looking at me trying to find this lump that we see on this picture right here that we can't find no more. And so that kind of scared me from a lot of things. I don't want to be scared to get a mammogram, but I'm scared to be able to feel what I felt that moment when, you know, they told me, oh, you have 2 lumps, but now we can't find them.
Okay, so what I'll say is, if you have a lump in your breast, do not be scared. That we can cure you. We can cure you of the breast cancer. And it doesn't mean that we are going to cut off your breast. Like I mentioned, we can conserve your breast. Even in situations that we need to do the mastectomy, that's take off we can reconstruct a new breast for you using your own tissues to reconstruct a new breast for you. These services are available now in Ghana.
Okay. I'm so thankful for the new service, the new technology and everything.
So
that you're helping.
just that new breast will not be functional in that you cannot breastfeed or maybe have sensation, but then it will serve the purposes and it boosts your confidence also. So it doesn't mean that once we've diagnosed you of breast cancer, you are going to lose your breasts. Yes.
But you know, with no one telling you that, it doesn't. That's the first thing you think, like, I'm gonna lose my breast. No one never told us, like, you're not gonna lose them, or we have different technologies. But again, every year it's coming out with something more and more better to try to save women breasts.
Exactly.
And because it does lower a woman's self-esteem when she does get her breasts cut off. But I do appreciate you stopping by today. I appreciate you guys sitting on this panel, just having this conversation and sharing some of the, things that we didn't know. That's why we answer you so many questions. But if we don't ask, we won't know. And so that's the point. That's the reason for this Pink Conversation on Fridays. I would like to say thank you guys for tuning in. We'll see you next Friday with a new panel. And next week, we're going to have someone that's going to give us some resources on where you can go and the different, what you need to go. And like she said, you could walk in. But we have more resources to be able to tell you guys. Until next week, thank you guys for tuning in to Pink Conversation with Marsaw Media. Bye.
Bye. Bye. Thank you so much.